Position the patient so they're slouched forward, arching their back to open up the vertebral spaces. Place both your hands on the iliac crests. An imaginary line between these points goes through the L4 vertebra. You can then count up the vertebral spaces. Palpate the L3, L4 intervertebral space. L3, L2, L1, T12, T11, T10, T9 to 10, and finally the T8 to 9 space. This is the chosen level in this patient. Make sure you keep to the midline. Make a note of where this is. Many people will also make a small mark here. Scrub up and don your gown and sterile gloves. Now set up your equipment. You need a loss of resistance syringe, such as this Portex syringe. This needs to be filled with saline. You need the epidural catheter itself. This has graduations along it to tell you how far it's in. This can be attached to a hub through which saline can then be flushed. The TUI needle also usually has wings that you can attach to help maneuver it. Note the TUI needle has a special tip called a Huber tip, which has a curved end and a hole at the side so that the catheter can be fed in the right direction. You also need an antibacterial filter, local anaesthetic such as lidocaine, a 21 gauge needle, a 25 gauge needle, a syringe, sterile gauze, a sterile drape, and some skin prep. Clean the skin starting at the intended puncture site, gradually moving out in ever-increasing circles. Dry any excess off. Apply a sterile drape such as this plastic transparent aperture drape. Reconfirm the chosen level. Warn about a sharp scratch. Inject a bleb of local anaesthetic in the midline at the pre-selected site using the 25 gauge needle. Then change to the larger 21 gauge needle and direct it deeper in the direction of planned needle insertion. Take the TUI needle and insert it at the pre-selected site, being sure to stay in the midline, keeping the bevel of the needle up. Pass through the skin, subcutaneous tissue, the supraspinous ligament, and then the interspinous ligament, which will feel quite tough. Remove the obturator from the inside of the needle. Attach the saline-filled loss of resistance syringe to the needle. Gently inject. There should be resistance initially. Advance the needle a millimetre and apply pressure on the syringe to check for change in resistance. Keep doing this 1 millimetre at a time. Resistance to injection will gradually rise initially. This coincides with arrival of the needle tip in the ligamentum flavum. Just after this, the resistance is lost. The saline flushes easily, meaning the needle tip is now in the extradural space. Remember that the total needle length is 10 cm, so subtract the 2 cm for the hub and another 4 cm for the remaining visible needle. This tells us that the needle is 4 cm inside, or in other words, that the distance from skin to the epidural space is 4 cm. You can now thread the epidural catheter through the needle. Here you can see another small plastic attachment, which just helps with threading the catheter. The epidural catheter should pass in very easily. Ask the patient if they can feel anything down either leg. The epidural catheter has markings to show how far in it is. Here there are 4 small black lines, which indicates the 20 cm mark. We know the TUI needle is 10 cm long. This means that 10 cm of the epidural catheter is inside the epidural space, which is more than we need, but this is okay for now, as some of the tube will come out inadvertently when the needle is withdrawn. Feed the catheter in as you gradually withdraw the 2E needle. As soon as you can, grip the catheter close to the skin and remove the needle. We now have 13 centimeters of catheter inside the patient, and we know already that the distance from the skin to epidural space is 4 centimeters, so there is 9 centimeters inside the epidural space. We want 4 to 6 centimeters, so the catheter can be withdrawn a little. Attach the hub device to the end of the epidural catheter. Attach the antibacterial filter. Attach a saline-filled syringe and aspirate gently on this to ensure there is no blood or CSF draining out. Then inject a small amount of saline gently to ensure the tip is still in the epidural space. For now, attach a cap to the antibacterial filter. Clean the skin and remove the drapes. Don't worry if there's a small amount of bleeding from the puncture site, this is normal. Secure the epidural with an adhesive dressing.